Hello and welcome to our Nursing Times bite-sized learning video series on heart failure. Over the course of 5 educational videos, we will be covering heart failure pathophysiology, heart failure causes, diagnosis, management and also related end-of-life care. Each video is presented by a nurse who is an expert in the field of heart failure. We hope you find this series an informative and useful tool to both further your knowledge, raise awareness and ultimately improve your care of heart failure patients.
Hi, I'm Teresa Onwari Tan, and in this video we're going to talk about the causes of heart failure, or etiology, comorbidities and the risk factors that can lead to heart failure. So in the previous videos you've learned about what heart failure is, the types of heart failure, and as you know that there are now 1 million people in the UK who have heart failure. You've also learned about the symptoms of heart failure, which is also very important to know about fighting for breath, fatigue and filling up with fluid, which is a very useful mnemonic that was created by the BSH, or the British Society of Heart Failure, in spotting out those symptoms for heart failure. Now, you may think, what is the main cause of heart failure? Well, the obvious answer may be the heart. So one of the main causes of heart failure would be coronary artery disease or ischemic heart disease. As you know, there is atherosclerosis that can occur. So you have some atheroma or fatty plaques that can build up in the heart arteries. And this can lead to blockage of nutrients and blood flow. And this can lead to, of course, myocardial infarction and angina. So it's very important that this is treated, as this can lead to worsening heart failure. Another cause of heart failure can also be hypertension or high blood pressure. So in this, when it's uncontrolled, when you don't have your ACE inhibitors like ramipril or ARBs like losartan, then this can lead to the heart muscles and the ventricles being dilated and thickened, and this can impair the pumping function. It's also important to understand that the valves are very important in this. So you have your 4 different valves: your tricuspid valve, your mitral valve, your pulmonary valve, and your aortic valve. And with these valves, you can have stenosis, so narrowing of those heart valves, or you can have regurgitation, where there is leakage of those valves. And again, this can lead to impaired pumping function. It's also very important to know that cardiomyopathy can cause heart failure as well. So the word cardiomyopathy, cardio being heart, myo being muscle, and pathy being disease. So it's a term that's used for a group of conditions where the heart muscle is affected. So it's important to know those types of cardiomyopathies. So dilated, hypertrophy, and restrictive cardiomyopathy. This can lead to heart function or heart dysfunction, whereby the heart is dilated, it's stiff, it's not pumping very well because it's very thick. So these can lead to heart failure. There is also arrhythmogenic cardiomyopathy, historically known as arrhythmogenic right ventricular cardiomyopathy. This is where it's a genetic disorder that again can lead to heart dysfunction and pumping dysfunction. So it's important to know about peripartum cardiomyopathy, where pregnant ladies can develop cardiomyopathy in the beginning or towards the end of their pregnancy, and they can get the previous mentioned cardiomyopathies. So it's very important to have an echocardiogram with those ladies. There's also left ventricular non-compaction cardiomyopathy, where the heart is very spongy. So again, that causes an issue. Okay, the next cardiac cause of heart failure is also arrhythmias. So this is an abnormal heart rhythm that can potentially be life-threatening. Particularly, they can cause cardiac arrest if they are not well controlled and managed, such as atrial flutter, atrial fibrillation, atrial tachycardia, and etc. You also have pericardial disease. So the pericardium is a thin sac that protects the heart. And in that, you can have issues with the pumping function if there's a disorder that occurs, such as pericarditis, cardiac tamponade. It's also important to know that congenital heart diseases can also lead to heart failure. So those are conditions that you're born with. So it could be like an atrial septal defect or the previous mentioned conditions. And so it's very important to have those controlled. It's also important to know that there are other causes of heart failure, not just cardiac causes. So you may have, for instance, pulmonary causes. So you may have a pulmonary embolism, so clots in the lungs. You may have chronic obstructive pulmonary disorder or COPD. You may have pneumonia. So those things can lead to heart failure. There is also renal disease, so your end-stage renal failure or chronic kidney disease, membranous nephropathy can lead to that. You also have infiltrative disease such as sarcoidosis, which is where there's inflammation that leads to clumps in the skin, in the lymph nodes, in the lungs. You can have amyloid, where there's protein plaques that can be deposited in the organs of the body, and that can lead to heart failure. Infection can also lead to heart failure, so myocarditis, HIV, your parasitic infections such as Chagas and Lyme's disease. There is also drug-induced causes such as alcohol, non-steroidal drugs such as ibuprofen. You can also be caused by toxins and recreational drugs. And as you can see on the presentation, there are a lot more other causes of heart failure: diabetes, thiamine deficiency, B1 deficiency, surgery, and of course advancing age. It's very important to advise good healthy living with your patients. So these are patients who may have high BMI, who have high salt intake, high alcohol intake, and smoking. These can be risk factors towards heart failure and other chronic conditions, so very good to manage these. Obviously, this is not an exhaustive list. There are many causes of heart failure. This is just a few to name. And of course, there is idiopathic causes, which mean there is no set real cause of heart failure. We just can't find that cause. But yes, there are definitely many, many causes of heart failure. There's so many people with heart failure. It's important to be aware of heart failure. The symptoms of fatigue, fighting for breath, and filling up with fluid is not necessarily exclusive to heart failure. That can occur in other conditions. It's also important to be aware that the everyday heart failure patient may have other comorbidities such as COPD, diabetes, renal disease, obstructive sleep apnea. So it's very important that you're aware of these symptoms so that you can access or get those patients to those diagnostics and the right treatment to help them in their quality of life. Here you can see all the resources that are very useful in terms of learning about heart failure and the causes of heart failure, understanding how to diagnose and to manage heart failure. And it's very important that you learn about these because this will help the patient's quality of life and prevent them from having deterioration in future. For more details, have a look at the other videos. Thank you.